Since 2006, Medicare beneficiaries have been fortunate to save thousands of dollars on prescription drugs through Medicare Part D. In this video, we're going to be talking about why you should enroll in a Part D plan, an example of how the penalty can cost you far more than you think over your lifetime, how a plan actually works, and why you don't have to do this alone. We help with understanding Medicare and what Medicare covers. Remember, we make Medicare easy. In this example, we're going to say that Mr. Jones is turning 65 and chooses not to enroll in a Medicare Part D plan since he is not taking any prescriptions. A couple of years go by and then Mr. Jones gets put on a $300 per month prescription. Of course, he is now wanting a prescription plan to start covering these costs. Bad news is that he will continue to have to pay those costs until January 1st of the following year. Mr. Jones will not be able to choose a prescription plan until the annual enrollment period, which is between October 15th and December 7th of each year. And then that plan will not go into effect until January 1st. Worst news is that he is going to be paying an ongoing penalty for delaying. Medicare says that for every month you could have been enrolled in a Part D plan but chose not to, you will be charged a 1% per month penalty. In our example, Mr. Jones waited 2 years, so he is going to have to pay a 24% penalty, which will be added onto his prescription plan premium each month. Here's where the penalty gets really confusing, since the 24% is not based on the premium of Mr. Jones's plan, but what the national average is for all Part D plans. In 2022, it is around $32, which means his penalty will be right around $7.70 per month. So, if the plan that Mr. Jones ends up enrolling in costs $20 per month, he will actually pay $27.70 per month. Compounding this issue is that the national average can go up each year, which means his penalty amount will go up as well. As you can see, it is simply not worth rolling the dice and going without coverage. Now, what you need to know is the fact that you can get your prescription drug coverage either as a standalone Part D plan, or it can be through a Medicare Advantage plan that offers prescription drug coverage. With either of these ways to get your prescription coverage, you need to know that these plans will have you progress through different levels of benefits. In the beginning, the first thing you might encounter is a deductible. Not all plans have a deductible, and some plans might have a lower deductible than others. So one carrier might have a $480 deductible, which is the standard deductible for 2022, and another carrier might choose to have a deductible of only $240. Don't panic about deductibles, since many times your generic drugs that are in the lower tiers don't even fall into the deductible portion with many of the plans. After you have met your deductible, then you move into what is known as your initial coverage, which is where you're going to either pay a copay, which is a flat dollar amount, or a coinsurance payment, which is actually a percentage of the cost of the drug. Typically, generics will have a copay, but more expensive drugs will fall into a higher tier and require you to pay an actual percentage of the drug. From here, we move into the coverage gap, or commonly known as the donut hole. The good news is that unlike many years ago when you were responsible for the total cost of the drug during this level, you now only have to worry about paying for 25% of the drug cost. Most retirees will not even enter the donut hole since it requires a total of $4,020 being spent on medications between what you pay and what the insurance company pays. Once you exit the donut hole, you are now in what is called the catastrophic coverage phase, which means you are only responsible for either 5% of the medication cost or up to $8, depending on which is higher. For many of you who are just going on to Medicare or have only been on it for 10 years or less, you might think that Part D is really not all that great with the different copays and out-of-pocket expenses. I want to assure you that while it is not perfect, it is far better than what Medicare beneficiaries had prior to 2006, which was absolutely nothing. I have personally been specializing in the Medicare market for well over 30 years and can remember when my clients were using pill cutters such as this and try to make their medications last longer. Remember, they were paying 100% of the cost each month. If the drug was $400, then they had to pay that amount out of their pocket with no help. So while Medicare Part D is not covering 100%, it is helping retirees afford their much needed medications. As you can see, there are quite a bit of details that go along with Medicare Part D. While many agents would prefer you to go online each year and figure out which plan is best for you, our advisors take that work off of you. The goal is not to look at just what the prescription plan premium is, but rather what your total out-of-pocket costs are for the year. By working with Senior Benefit Services, you will have a dedicated advisor who will make sure that each year you're in the plan that is best suited for your particular needs. If you found this video to be helpful, please be sure to click on the like button and share it with friends and family. Senior Benefit Services is licensed in just about every state, and there is never a charge for our advisors to help you with any of your insurance needs. Enjoy our educational videos here. Visit our website by clicking the link in the description, or to get started today, just give us a call at 800-924-4727.